Gone are the days where traditional forms of patient care were enough. Today, the use of digital tools such as telemedicine, mobile health apps, and wearable devices have paved the way for an era where patient care goes well beyond the walls of hospitals and clinics. Joining us in this keynote session, our esteemed speaker, Carey Officer, Vice President, Service Delivery Innovation, Center for Health Delivery Innovation, Nemours Children Health. She will share her knowledge as she examines the topic of this session, going well beyond medicine through digital engagement. Please put your hands together for our speaker, Carey Officer.
Thank you. So good morning, and it's a pleasure to be here, and thank you to Health 2.0 for bringing us all together. Hopefully we can make this an engaging experience. I enjoyed the talk earlier, and I'm going to talk a little bit about the humanization of healthcare and where we're headed and kind of blending the technology with the personalization and humanization of healthcare. So looking forward to the dialogue today. A little bit about Nemours Children's Health. We are a pediatric health system. We're based up in the Northeast. We have a freestanding hospital in Wilmington, Delaware. And we are also based down in Florida. We have a freestanding hospital we opened about 11 years ago in Orlando. We service both markets. It makes for interesting deployments because very different regulatory environments and policy between the two. So that keeps us busy. So today's presentation, I'm going to talk a little bit about Nemours Children's Health and how we are deploying technology across the continuum of care to improve patient engagement and outcomes, enhancing care coordination and delivery, and even going well beyond medicine. So you're probably saying, well, what does that mean, going well beyond medicine? We're at Nemours Children's Health, we believe in the whole child and supporting every aspect of the continuum. That includes emotional, behavioral, economic, and even environmental conditions that impact children's lives and families. So it's really important. You heard a lot earlier about technology. There is a huge buzz around digital technology today, right? You hear about AI, interoperability, all these capabilities that we have at our fingertips, which are truly amazing. I personally am excited to implement them all. But what we cannot lose sight of is that human-centered experience. And so we believe at Nemours, when we're getting ready to deploy any type of technology, we don't start there first. We start with the problem. We pull all the stakeholders in the room. That's patients, that's families, that's consumers, that's healthcare providers and technologists. And we apply human-centered design and really build out the journeys based on what we're trying to accomplish. We use agile methodologies in order to quickly iterate. Sometimes we have to change. Sometimes that hypothesis didn't work. And so we have to deploy and really adjust the way that we're deploying our technology. So the picture of this family here today, this is a Nemours family. And little Kai, who's sitting in the middle, is only a few months old. Before he was even born, he was diagnosed with a congenital heart defect. A few weeks after he was born, and of the months preceding, he had 3 open heart surgeries. It's families like these that help us figure out that we must do something more. And so today, I'm going to walk through a journey with you and illustrate what we're doing at Nemours in order to impact the lives of these families. So this is a busy slide. Down at the bottom is our strategy. We are focused in my team and the whole organization, on deploying improved patient experience through the use of digital technology. Not only are we in an era where consumers, patients, and families are demanding things to be more convenient. They want healthcare to be more like other industries. It's time for us to step up. In addition, we are also seeing burnout from caregivers. They have gone through tremendous pressures through these, during this period of COVID and beyond. A lot of them are retiring. We must begin to address these challenges internally as well and leverage automation to the benefit for not only the patients and families we serve, but also the caregivers that are taking care of these families. So I'm going to take you through a hypothetical journey today of a family. I'm introducing you here to Steph and Jim. And Steph and Jim already have a 2-year-old that you can see here they're playing with. In addition, they're expecting a child. And in a routine ultrasound that they go in, they find out that their child has a heart condition. After some additional tests, they find out that their son has hypoplastic left heart syndrome. Sounds pretty scary, and it is for a family facing this, to even know before your baby is born, you're going to have to go through a pretty hefty medical journey. So as any prudent parent would do, once you hear this news, they go on to Google and they search. Fortunately, Nemours is invested in education, Nemours Kids Health. You can go to kidshealth.org. We built this website back in 1995 and have been investing in it ever since. It is the world's renowned source for health education for parents, kids, and teens. And so we bubble up on the top of the page and teach Steph and Jim all about the condition that they're willing to face, or they're going to have to face. So they fill out a little form once they have, they fill out a little form when they're on the page to learn a little bit about Nemours. And they're entered into a nurturing campaign. And this is an example of that. So for several of our top subspecialties, we actually have parents go to these forms. They can fill out information and are entered into a nurturing campaign where they're sent emails and then also followed up with from clinical care teams. So one of the emails that they receive from the nurturing campaign, they are sent to nemours.org. So at nemours.org, they have an opportunity to learn more about our clinicians, to learn about our clinical care teams, to learn about their bios, their research, and most importantly, their outcomes for these types of conditions. Jim and Steph are starting to build confidence and educating themselves on this journey on how they're going to be able to pick their care team. So fortunately, since they enrolled in the campaign, they receive a call from the cardiac care team. And they talk to them a little bit about their questions, what concerns do you have? And through that conversation, they're offered a consultation. So as a part of the consultation, actually Jim and Steph don't live very close to Nemours. They're about 2 hours away. So having that opportunity to transport and go have an appointment and just have a conversation seemed a little overwhelming. And so the care provider offered them a telehealth consultation. They loved it. They said, absolutely, we'd love to do that. And as a part of that, they had never really experienced telehealth before. And so they were put into an automated chatbot. And they received information on how to prepare and get ready for their telehealth visit. This was very reassuring to Steph and to Jim as they then prepared for their telehealth visit. So we are utilizing telehealth chatbots in a number of different use cases. One is for the telehealth chat, and at Nemours, we actually saw a reduction of 50% in no-shows, which was pretty surprising to us that this type of automated communication could reduce no-show rates. So that really opened up the door to ensure that our clinicians were staying productive with their time and that, wanted spots didn't go wasted. The automated chat program, conversations unfold automatically. They provide highly personalized guidance to help keep patients on track and truly serve as an extension of the care team. So this is a chart, and at the bottom of it, it lists the use cases that we have deployed in relations to this automated chatbot. So in addition to telehealth, we also applied it towards appendectomies, tonsillectomies, and you can see the number of other use cases below. The blue bar is the satisfaction rate, which was significantly high across really all the use cases. Parents liked it. The engagement rate was really dependent upon the use case. So you can see the care deliveries around appendectomies and tonsillectomy, the engagement rate is significantly high. In fact, right now, we're doing some research around tonsillectomies, and we are seeing a statistically significant, I should say, impact on ER bounce back utilization. So these chats are working, they're engaging. Parents like them, they provide our education, they provide extensions to the care teams should they need our help. In addition, our care teams are really finding a lot of value. Now they're monitoring the dashboards and they're reaching out to those parents who need them, not making unwanted calls, but truly connecting and helping those patients in need. So Jim and staff proceed with their telehealth consultation. They find it easy and convenient. They were well prepared through the chat to be able to have that. And not only do they have the opportunity to leverage the telehealth visit to meet with a cardiologist, the cardiac thoracic surgeon, and also the prenatal perinatal team, they could do that all in one sitting. They didn't have to do separate visits, so it made it really convenient for them. And they decided that they wanted to move forward with Nemours to take care of their child. So a few weeks before Steph is due and the baby is born, they actually need to move a little bit closer so they can take care of various tests, appointments, and get ready to have their baby. And Steph is a little concerned. They live 2 hours away. She works full time. She's not going to be able to work during this period. They're on a budget. They don't have good equitable transportation, and they're concerned about lodging. And so one of the care coordinators reaches out proactively and asks Steph if they need help with these things. She's overwhelmed and a little bit wowed. I can't believe a healthcare system is concerned about how I'm going to get to you and then where I'm going to stay when I deliver my baby, and then also post delivery as well. Steph remembers filling out a questionnaire, and Nemours was asking her about some of these social determinants of health. So as part of the intake process at Nemours, we ask our families to fill out social determinant of health questionnaires and screeners within the Nemours app. That information is then tagged, and if activated, the care team members proactively reach out to connect the families to other community programs that we built relationships with. Now, the success of this program is truly dependent upon those relationships that we're building in the communities that we serve. It's really important, and you can see a list of some of those here. We even are using technology to try to advance some of those connections. So for example, the Data Access for Student Health, or the DASH program, as we have called it, we have built a database with the schools in the communities we serve. And when a child is absent more than 3 days, we proactively reach out to see if they have any health concerns or issues. Again, it's about seeing what's happening, being proactive, and then leveraging technology to our advantage and to the parents' advantage. So a few weeks, as I had mentioned, Steph and Jim come to the local area. They have several appointments and tests that need to be conducted before Steph has the baby. And they're impressed when they go in and meet with the physicians in person. They spend a lot of time with them. They're not typing on a computer at the same time. And they felt like they had more time with the clinicians, answering their questions and calming their concerns. So we have a small team at Nemours who, on a part-time basis, really focuses in on physician burnout and the amount of time that physicians within our health system are spending in the electronic health record after hours. They monitor it. And they're always looking for ways to be able to improve clinician workflows and reduce the amount of time that they're spending within the electronic health record. We implemented a system called DAX, Dragon Ambient Experience. And this system is AI enabled. Its whole focus is to improve the patient experience between the physician and the provider and completely reduce the amount of time that providers are spending in the electronic health record. It's been super successful. We did a pilot with about 25, 30 physicians. We not only heard from the clinicians that they love it, they feel like they have more time to be able to focus in on the patient care and not worried about building that or documenting within the electronic health record. The ambient software actually listens in and takes that full conversation, creates a full note, and then the physician can review it and sign the note at a later point in time. Parents love it because they feel like the doctors are more focused in on them and not typing away in the middle of the visit, which is somewhat distracting to parents. You know, a lot of things that we have heard from parents, what are you typing about me? What's happening there? And so those are really important aspects of the whole care delivery. And so that's one use of technology that really can benefit not only the patient-family experience, but also the clinician burnout factor and the amount of time that clinicians are spent documenting in the electronic health record. So Steph and Jim have their baby, and a couple weeks after delivery, their baby goes into surgery, is doing wonderful, comes out, has quite a lengthy inpatient stay at the hospital. And we've really focused in here with the cardiac team spending a lot of time with the parents getting ready for them to go home. What do they need to learn? What do we need to teach them? And we leverage our educational material that we've developed through videos. They can watch it on the inpatient TVs. We leverage our patient instructions, which are written in the 4th grade reading level and have illustrations. Those are at their fingertips within the Nemours app when they go home. So a lot of work, in addition to healing, is educating the whole entire family when they're in the health system. Another thing that they learned, and is a little bit unique to the Nemours health system, we developed this about 11 years ago when we opened our hospital down in Orlando, Florida. This is our tactical logistics center. This was built to give a second set of eyes and really focus in on quality and safety within our health system. So this team right here, a group of paramedics, is basically monitoring every single bed in our health system. So the ones in Wilmington, Delaware, the ones in Orlando. And if they have any concerns, we have digital technology within the room. They can remote directly into the room to have conversations, see what's going on. They also have the opportunity to call a rapid response team. So if they see a child deteriorating, they have the opportunity to hop on it, if you will. And so this is great. This is something I think when we think about the quality of care and safety, when patients and families are in our care, this is a critical piece of that continuum. So I talked a lot about education. We have patient instructions, we have videos, we have a lot of content, and a big part of pediatric care is educating. It's educating mom, it's educating dad, it's sometimes educating extended family members who might be a big part of the care at home when some of these kiddos go home. So we try to take our content and really deliver it across multiple platforms that are easily digestible and engaging for parents and families. So that could be TVs in hospital rooms. We've created the Nemours app, which pulls together all of our legacy systems. So parents have this just-in-time information at their fingertips, and even leveraging it within the automated chat box that I was talking about earlier. So when Steph and Jim go home, thank goodness that they have this Nemours app. It's the one place they can go to do everything Nemours. They can message their caregivers, they can communicate back and forth, they can set up appointments, which I'll talk a little bit about in a minute. The cardiac team also, before they go home, with this specific child and this specific condition, prepare them and educate them on how they're going to communicate about their child's health. So we've developed a remote patient monitoring tracker for the parents. It's quite low tech, right? Parents are going to be entering the information themselves, and they're very compliant, I can tell you. So they have the opportunity to report on daily oxygen saturation, heart rate, weight gain, and other important vitals that the care team wants to keep up with on a daily basis. They also ask the parents to take a video every day so they can watch the breathing and watch the incision and how it's healing, so they can be more proactive in the care should they see anything before the next in-person visit. In addition, they have the ability to have regular telehealth check-ins. So all this information is automatically streamed to the clinician dashboard. They're monitoring it on a daily basis, keeping up with it, and they even have alerts. So for example, if their heart rate is out of the range that's been projected by that clinician, they get an automatic Volt alert to their phone and automatically reach out to the parent and family. So again, this is really leveraging technology to take an extremely proactive approach in care delivery. We don't want to wait for you to find something wrong. We want to find it out sooner. Talked a little about scheduling visits. So with Steph and Jim, obviously you're going to have a lot of appointments back and forth with the clinician. Our parents have the ability to go into the Nemours app and schedule all their appointments. In addition, we have built and released the ability for Steph and Jim to now basically do all the registration virtually, check in, and even arrive themselves, all digitally. So when they get to the health system, they don't have to worry about going to a desk, paying a co-payment, filling out various forms. They basically have the opportunity to walk in and be called back and see what they're there for, right? The physician and care team. And then we're trying to make payments easy at Nemours. And so again, through the Nemours app, we know that most families are focused in on the care and their health and the well-being of their child. Billing, the dollars, the finances can be very frustrating, very confusing for families. And we have developed the capabilities so they can come in and see our financial advisors. We provide them the opportunity to have a phone conversation, a telehealth conversation. They have the ability to pay for co-payments before their visits in the app. In addition, they can even set up payment plans. So if they have an outstanding balance and they can't pay it all at once, they have the ability to automatically set that up within the Nemours app. Again, we're trying to make this super convenient and super easy for families, but then I'll have the outs, right, with our financial advisors to be able to have those tough conversations and really understand what they're paying for. So another aspect of Steph and Jim's journey, and we actually just came up with this and released it. We've been working with our research team. And when you find out that your baby has a congenital heart defect, it is stressful. It's going to change your whole dynamic and life outlook. You're really not sure what you're in for. And so our researchers decided to develop an application that is really built for when mom is pregnant, all the way through having a baby, with resources, additional education, outlets with other parents who are going through the same conditions to really bring in that sense of community and support network. So we just deployed, it's called Heart Prep. In 2023, Dr. Erica Sood here, which is mentioned, it's just one little screenshot. We've also done this with 2 other research projects. These are all NIH funded grants. One called MICA that is focused in around obesity, and then a third one called R2D2, which is focused in diabetes. What's so exciting for us in this space is that in the past, research has gone off, done their research, hired other technology companies, and then when the funding runs out and they have what they hypothesized work, and we try to bring it to the bedside, we have to build it all over again to integrate with our current system. So it's wasteful, it takes a long time, and when something works, you want to just deploy it quickly. So now we're integrating with this team and actually developing these applications to be a plug and play. So if these work as hypothesized, we flip a switch and then we're ready to go, really saving a lot of time, money, and reducing waste. So I introduced you earlier to a family from Nemours, little Kai here, who's just a few months old. And we've been working really, really hard at Nemours to integrate these care journeys, really starting with the journeys and understanding where we can implement the technology in between to really bring true benefit, better patient experience, better outcomes, more engaging care and delivery. And I want to end today with a short little video that really describes the parents. And this is why I get out of bed every single day and do what I do. And I know a lot of people across Nemours feel the exact same way. And I know many of you are working on similar goals and implementing technology. And I think this is probably the mission and the reason why that we all do what we do. So now we'll play this short little clip.
Well, I found out pretty late in my pregnancy that we were going to have a child with CHD, congenital heart defect. It's a little devastating for a first-time mom. I didn't know what this journey was going to entail. I was 28 weeks and I had him at 34. So I didn't have a lot of time to actually process what was going on. I prayed for my son to be healthy, and to hear that he was not was very devastating to me.
Kai was born with a complex form of congenital heart disease, which is called double outlet right ventricle, which is basically two arteries coming out of one pumping chamber, the right-sided one. That's why it's called right ventricle. This condition certainly is something that would not allow you to live if it's unrepaired. Most patients would not survive to a year of age.
As a father, the main thing you want to do is protect your child. So when you hear that there's nothing you can do, kind of, it hurts a little bit.
I don't think I was prepared for what we're about to go into with this journey until I met the people here at Nemours Children's Hospital. And being here has changed my life, has changed our life. And I'm a better person because of it. Crazy to say. But this journey has taught me more than I would have ever imagined.
Our team has developed a program called Heart Prep. The goals of Heart Prep are to help families feel less distressed, less alone, more prepared, and more hopeful after finding out during pregnancy that their baby will be born with a heart condition. And what we found is that 90% of expectant mothers who are offered participation in Heart Prep choose to enroll in this study. And that's remarkable. 90% of families find that this is something that they feel that they need.
It meant a lot that my wife had access to Heart Prep and the psychology team here at Nemours. As a husband, you try your best to have your wife lean on you. And sometimes, she doesn't want to express everything that she feels. So it was really great that she had somebody to talk to. I don't think I would have been able to get through this difficult time if it wasn't for Heart Prep. We're doing good. Having Kai home, having my oldest son, if I finally have his little brother home, everybody's doing great.
Oh, I love to brag on him because he's doing awesome right now, considering he has had now 3 open heart surgeries, 1 cath procedure. He has, crazy, he has suffered from cardiac arrest before. His aorta ruptured. And to see him now where he is today, it is truly a miracle. It is remarkable. I am grateful to be his mother.
So this is why we do what we do. So thank you so much. If anybody has any questions, I'm happy to answer what I can with a couple minutes I have left.
That was amazing. Thank you so much. Just a question about the future of the health records that you collect. Have you thought about how you carry that forward so that the patient might consider that at future states in their life, future health states? So 10 years from now, 20 years from now, and really provide that extra longitudinal data.
Yeah. I mean, the data is always there, but how we begin to make it interoperable and really build that long-term record in history, I think is a phenomenal challenge. We're starting at the very beginning. So I think it's going to take partnerships. I think we're challenged in healthcare right now. There's a lot of competition, right? And it's hard to play in the same sandbox. And to be able to do these kinds of things, we're going to have to play together better and figure out, because this is humanity. This is what we're all in the mission of healthcare for. I mean, technology's cool. I love it. Don't get me wrong. But at the end of the day, we want people to live healthy, happy lives to their best of their ability. Thanks. Good question. Yes, sir.
How does the work that you're doing at the Nemours level integrate with primary care providers to make care seamless for the people that you're serving?
It's a great question. So we do have primary care, And we also work with a lot of primary care organizations. So up in the Delaware Valley, we have built a clinically integrated network. And I say we, but I truly mean we, with the primary care providers, are all coming together to be able to take care of populations of children. And our goal is to really build communities of the healthiest children, right? Think about sending that and what that could do to the cost curve long term to be able to really impact their lives. So it's a community effort. Thank you for the question. It's something we're pretty passionate about as well. I think I'm getting the no. Let's talk afterwards. Or
Yeah.
yes, no? Okay, we'll talk afterwards.
Yeah.
Okay.
It's okay.
Sorry about that, everybody. Thank you so much for the time today. I really